what is immunotherapy and how does it work to treat lung cancer?
So immunotherapy technically can be used to treat almost every cancer. So it's this concept that over time, the cancer cells learn to bypass the immune surveillance, which is the way that your body identifies cells that are abnormal and gets rid of them. Your immune system can do that. And over time, cancer grows and grows faster because your immune cells don't even recognize that the cancer cells are there. So immune therapy, specifically the checkpoint inhibitors, they target a receptor that is overexpressed in cancer cells that make cancer cells invisible to the immune system. So when you use, for example, some of these antibodies that bind the PD-L1, the programmed death ligand 1 receptor, that in itself gets rid of that veil that is covering the tumor cells, and now your immune system can recognize the cancer. And that is one way of activating the immune system against the cancer, checkpoint inhibitors. There's newer drugs that are coming in the market, newer kind of engineered immune cells that will in the future be able to be developed for that specific cell. And it's, in a way, immune therapy is more natural because it is where you're not getting a chemotherapy that causes nausea or hair loss. You're getting your immune system kind of ramped up, activated against your cancer cells. It can have side effects. So when you activate all these immune cells, you can cause inflammation in the body that has to be monitored. And some patients can be serious. And also people have developed autoimmune kind of antibody reactions. So there is a lot of monitoring that needs to be done. It's given intravenously. We have doses now that last up to 6 weeks in some of the major immunotherapies that we use, like pembrolizumab. So you don't have to come all the time. And I think the one thing that I've seen that is very promising about immunotherapy is that if you activate your immune system, almost like when you get a vaccine that when you were young, you got a vaccine and you don't have to get it every year, like you have a memory response against that virus. Immunotherapy can achieve that for about 20 to 30% of patients today, where they get this memory against the cancer cells and they can potentially come off treatment.